Hello, Dr. Dileep Gude here, physician, Somajigoda Yashoda Hospital. We'll discuss about liver damage and the kinds of symptoms one can expect, especially when one's liver gets damaged. So we know these common things like hepatitis, as in when there is increased bilirubin. We know that there is some degree of yellowing of sclera when eyes start turning yellow. Even the palms also start getting a yellowish tinge. So especially the level of bilirubin, if it is 5 or more, your palms start showing it. So there is a yellowish tinge in the body as a whole, especially when starting with the sclera of the eye. And of course, the telltale signs of liver damage, especially for long-standing liver damage, are usually there is increased belly size, especially because of ascites, that is nothing but fluid accumulation in the abdomen. So when liver starts getting shrinking, there is increased body that is water storage in the tummy, and there is a swelling of the feet as well. So we call it anasarca. There is a pedal edema, as in swelling of the feet. There is a lot of fluid in the tummy. Then of course there is wasting. There is a lot of muscle wasting that occurs in liver diseases, where the muscles of upper limbs they all get skinny and cachectic, and people start developing these signs of chronic liver disease, where the axillary hair also comes down, even the beard and mustache, that also comes down. And then there is there are something called palmar erythema, that is redness of the of the palms especially. Then there is a Dupuytren's contracture, where the palms get a little contracted in the hands basically. And then the spider nevi are nothing but dots of red dots that you can see, especially in the sun-exposed areas, where there is increased blood vessel vascularity. We call it telangiectasia. So these are features of chronic liver disease. So, but then these are features of a long-term chronic liver damage. And in early stage, basically, you may only have yellowish sclera, and your urine may be yellow also as well. But then there are different types of liver damage, and sometimes all of it appears normal, and your liver damage can only come out only if you do a blood test, only if you do a liver function test, where high bilirubin or high SGPT and SGOT, or high PT and INR, all these. INR being high means your liver is unable to synthesize blood clot factors, which means that when there is a cut, your blood won't stop, your bleeding won't stop. There'll be because it won't clot, and then there is a lot of bleeding that occurs. So that is high INR, which is again typical of liver damage. So likewise, there are some telltale signs like increased SGOT, SGPT. These are enzymes in the liver basically. They may be 3 times elevated, 5 times elevated, depending on the culprit that is causing the damage. It can be viral hepatitis, it can be toxins, drug-induced hepatitis, like simple dolo, for example, or simple paracetamol, for example, can cause liver damage if taken more than adequate dosing recommendation. So when bilirubin goes up, for example, if somebody is on a TB medicine regimen, tubercular medicines usually cause hepatitis, so there may be increased bilirubin, that is yellowish discoloration. There can be increased SGPT and SGOT, and then increased INR, etc. So all this needs to be looked at in a holistic manner. In fact, alcohol is the most common culprit for liver damage, and sometimes even non-alcoholics also tend to have a condition called NASH, that is non-alcoholic steatohepatitis. So these are conditions which you need to discuss with your doctor, especially if you have these doubts. You can discuss with your doctor and then get these doubts rectified. So if there is liver damage, then you can give medicines that can help the liver regenerate, like for example glutathione, N-acetylcysteine, and of course you will have to stop the offending agent, like either it is alcohol or paracetamol, for example, or if it is viral hepatitis, you will probably need to treat it, or sometimes even malaria can cause severe hepatitis. Thank you.